was a lady down in the Gilroy area named Judy Kell whose daughter had leukemia. And in the final stages of the leukemia, the only thing that ever made her feel good was this little kitten that someone had brought over as a gift, and she would perk up a bit and play with the kitten. So when her daughter finally passed on, she decided one of the things that she wanted to do in memory of her daughter was to be able to give this kind of comfort to other people. And so we've been in officially Furry Friends Pet Assisted Therapy Services since that time.
Sir?
Shadow, look.
Sir?
There you go. There you go. Very good.
My name is Margie Palo. I work here at Sunshine Villa Assisted Living as the Activities Director. And one of our responsibilities is to plan, execute, and organize a variety of activities here for our 120 residents. And one of our most favorite activities, both for the staff and for the residents, are the pet volunteers and pets that visit from Furry Friends.
We're looking for an animal that enjoys being around people and being touched and petted, and that the owner can control. All of the animals have to go through a certification of some kind of veterinarian. They can either use one of the vets that we have on our list that will do the evaluation for them free, or they're welcome to take their pet to their own personal vet. We ask the evaluator to do things like make a loud noise to see how the animal responds to that, pull their tail, pinch their ears, possibly pinch between the pads of their toes or something. These are all things that could very easily happen with children or with elderly in particular. Then we also require all pets to go through an etiquette class. We have an animal behaviorist who does a class as needed, and she does what is appropriate behavior for a dog or a cat.
Once you come in and you volunteer to be a pet volunteer, and you see the reaction that one gets from the patient and residents that you visit, you'll know your time is being very well spent. Well, I think any volunteer or staff person or bystander who just sees the residents or patients interacting with pets can see just on the surface how much they enjoy the interaction. Their eyes twinkle, their faces beam, they're smiling. They just enjoy seeing the dogs. There's also the tactile stimulation of being able to pet the animals. The unconditional love that the pets will give the residents or patients also helps to make them feel so wonderful. Having pet therapy is beneficial for patients and residents.
The sites that Furry Friends visits are quite varied. We go to nursing homes, hospitals, children's shelters, schools.
Is your walker? Okay.
A lot of the people that we visit were their only visitors, especially in the nursing homes and children's shelters and places where people are kind of abandoned emotionally. And so they're very, very excited to see the animals come, and all the animals know that.
Oh, what a sweet.
She likes to get her pets.
It's great for them to be around people that want to pet them and want to touch them. And I think it gives them a lot of joy, too, to be able to do that.
So there are some things that can be helpful to make the visit as beneficial to the resident or patient as well as the pet volunteer. And some of those things would be for the pet volunteer to come in a good space, so to speak. They need to be calm, not rushed, not thinking about other things. They just need to be in a very relaxed state, because that can be communicated to the resident or patient that they're visiting with. And if they pick up on that, they may also become anxious or fearful.
Before you walk up to anyone, whether they're in a wheelchair or in their bed in their room, you always ask permission. Be respectful, the same thing that you would want, like I said, someone to do for you.
Another thing that's important when you're approaching a resident is to come up to them slowly, make direct eye contact. You may need to lower yourself so you're sitting near to them and looking them straight in the eye. You need to be talking directly to them so you can get their attention.
Before we enter a room, I knock on the door and I just ask.
Hi, Sally. I brought a dog to visit with you today. May we come in?
And if they say no, obviously we say thank you and we move on to the next person. I make sure she walks up quietly, not running and jumping in their lap or anything like that. And I have her usually sit in front of them. And you can kind of tell if the person is tentative or not. So if someone in that kind of an environment is petting my dog, my hand is just inches away from theirs, so I can intervene if needed.
Volunteers are not being asked to do anything that would be construed as a staff person's job. If you're visiting with a patient or resident and you have concerns about their behavior, certainly go to the nursing staff or the activity director with your pet with you, don't leave the pet unattended, and ask them to explain the situation to you or address your concerns to them. It's important whenever you're visiting a patient or a resident to treat them as an adult, even though their behavior may seem childlike. They're not children. Make direct eye contact. You may need to lower yourself so you're sitting near to them and looking them straight in the eye. You need to be talking directly to them so you can get their attention. It's always important to speak calmly, to be relaxed, to be patient, and don't overreact. It's always best if you're visiting someone with dementia to keep the task as simple as possible down to the barest minimum. It's good to provide reassurance to the person you're visiting. It's important to be flexible. If you're visiting someone and it's not working right at that moment, then perhaps walk away for a little while, go and visit another resident or patient, and then come back to the person you were visiting and try it again. And always ask for help from the nursing staff or most likely the activities director if you're noticing difficult behavior, and help them to address your concerns. Don't take any sort of offensive behavior, something a resident might do or say personally. And the most important thing to do before you step foot in whatever kind of community you're visiting is to be in a good space, to be in a calm frame of mind, to be relaxed, and to be prepared to have a good visit. Some of the things you've seen today or that we've talked about are appropriate and the way we do things here at Sunshine Villa Assisted Living. If you were visiting in a rehab center or a skilled nursing facility, commonly known as a nursing home, they may have slightly different procedures for doing things. So it's important to get a good orientation from your nursing staff or your activity director in the specific place you're visiting. You know, as an activities director, I'm forever grateful to the volunteers who will give up their time from their busy schedules to come in to visit. And in some situations, you may be one of the few people that's coming to visit a resident. So you can really, really, really make a difference in someone's life.
I actually feel very, very blessed to be part of this organization. It's the joy and the love that you can bring to people whose lives probably don't get a lot of attention or understanding or excitement or pleasure in their life. If you just think about being in a bed for 7 years and not getting up, that's pretty sad.
So I hope one would consider becoming a pet volunteer, and I'm sure they would find it very rewarding. I do what I do because I love it.